Dr. Deuk here on my YouTube channel, and I'm going to be talking about a Facebook post by somebody who underwent an artificial disc placement in their lumbar spine. That was for lower back pain. And there's a couple of things I want to discuss about this one. So take a look at this post here. First of all, there's a big picture of the actual scar from the surgery. And if you notice with the arrow, yep, that's a belly button. Hard to believe. It looks like something a lot worse than a belly button, but that's a belly button. Just to the side of it, you've got this massive scar. Looks like this person had a C-section, basically. And this person is showing their scar from the surgery. And this is pretty much what you can expect whenever you're having an artificial disc put in your lower back, because they got to go through your belly. Again, that's a very dangerous approach to the spine. You got all your intestines down there. You got blood vessels. You have arteries, you got veins, and God forbid any of those things get nicked, you're going to end up bleeding inside internally, and you could lose your leg from that. Now, there's some comment here made about swelling in their leg, and it turns out that there was damage to the sympathetic nerves, which cause blood flow to the foot. So this is exactly what I was talking about. This person's complaining about, hey, I just had an artificial disc put in my lower back at L34 and L45. And as a result of that surgery, now I got my entire leg swelling. And they're saying that they nicked the sympathetic trunk, which is a bundle of nerves that go down the leg and cause the blood circulation to move back up. And that's been damaged now from the artificial disc surgery, so their whole leg is swollen. I mean, gosh, I can't even imagine, putting a patient through a complication like that with surgery. With the Deuk laser disc repair, endoscopic spine surgery, you don't need artificial disc. We don't go through the belly. It's all done with a small 7mm Band-Aid incision. And we've never had a complication in 16 years of the surgery. So, something to think about.